Greenberg along with Dr. Jacqueline Ross. How are we doing today?
Good.
Great. How are you?
Good. I'm excited. Summer's here. We're all feeling good. There are so many patients coming in to meet with you all about the latest and greatest procedures because we all want to look and feel good. What right now would you say is the most common procedure people are coming in for?
I think summer is a combination of mostly body things. I mean, I certainly do a lot of faces all day long, but don't you think body, this time of year, everyone wants their breasts and their belly and their lipos done?
Yep, especially at the beginning of summer, so you can enjoy the bikini body for the rest of summer. Yeah.
So it's still not too late. We're
No,
here in the middle of June. We have time, right?
Yep, absolutely. Still plenty of time.
Yeah, with the rapid recovery programs that we do here at Greenberg Cosmetic Surgery, patients recover so fast. They can get back to that bikini, whether it's breast reductions, breast lift, breast augmentation, tummy tucks, or lipo. We can get you very quickly back to normal activities and back to that beach.
And that's what's most important. People want little to no downtime, but we also want to see the best results. And I know here, your team, pretty amazing. You've been doing this for over, not to date you, but 30-something years now.
Pretty much, yeah.
Yeah, and I mean, he's an expert in every aspect. And you're seeing a lot of facelift consults recently. That's one of your specialties.
Yeah, I do a lot of facelifts. I like a very natural look in my facelifts. I often will combine face along with upper and lower eyelid lifts and lasers and some fat grafting, you know, to give that great natural result with very quick downtime. But we can really contour that neck, those jowls, we'll bring up the mid-face and give an amazing natural result in a short period of time.
And even something that you taught me about was the mini facelift too, which is pretty amazing.
Yeah, I think mini facelifts do really well for patients with a little bit of a jowl, maybe a little laxity in the neck, and just gently pull this back up. So mini facelifts can go a long way to giving you that neckline that you've always dreamed of.
Yeah. Now, Dr. Ross, I know you specialize in breast, body, everything as well. What would you say your main specialty is?
I would say breast and body.
Okay.
I'm both of those. Do a lot of breast, especially right now. Just did a ballerina augmentation today.
What is that?
Yeah.
So small implant. Like a 175 cc's, just for a natural augmentation in a really slender patient who didn't want anything that was going to be super noticeable but wanted to look cute in her bikini for the summer. And so it's a nice natural way to do a breast implant, especially when you're on the smaller side already to begin with.
And a lot of women are coming in here now, of course, for our vaginal rejuvenation and all these women's type of needs. And I know you're working a lot with those patients, right?
Absolutely. So we do vaginal rejuvenation with a type of laser to help with tightening, lubrication, things like that. But one of my favorite things is the procedural side is the labiaplasty, and that's actually removing excess skin for women. Which is also super helpful, especially in the summer season when we're talking about swimsuits or tighter fitting clothes, just from a comfort standpoint.
Got it. And Dr. Greenberg, there's something that you use that people were asking about last week when we did this. They were writing in more questions about the J plasma. What is this J plasma liposuction all about?
So it's a type of laser we use based upon helium to help tighten up the skin at this time of liposuction. So if you have a little bit of skin laxity after having kids or massive weight loss, this will help the skin to retract in. And we often will do that at the time of just regular liposuction or our mommy makeovers, whether it's men or women. We tend to use a lot of the J plasma Renuvion laser.
Got it. And speaking of men, a lot of men are coming here into the practice to see you at all the locations, which, by the way, I know we always speak a lot about females, but there are tons of men coming in for their eyes, for their face, right? You've seen an uptick in that.
Eyes, face, guys do a lot of liposuction as well, male breast reduction, sculpt the abdomen, their love handles, do their necks, their chins, their eyes, and facelifts as well. So super common for guys to do a lot of these cosmetic surgery procedures.
Well, I love it because this is for everyone, and even on the younger side, Dr. Weissler himself, he's seeing a lot of the rhinoplasty patients too, right?
Yeah, Dr. Weissler does a lot of rhinos. He does them very naturally in office. They come out great, and they fix your breathing at the same time.
Amazing. All right. Well, also, I just want to thank you guys for being here today. As always, it's exciting to be here at the Woodbury office, but not to mention, how many locations do you have now?
A lot. We
Yeah.
We have Scarsdale, Manhattan, Woodbury, Smithtown, the Hamptons, and Florida. You can catch us all over. Dr. Ross, thank you so much for coming on today.
Of course.
Dr. Weissler, who's operating, Dr. Cooper, who's operating, and myself are welcoming you to any of our offices. Thanks for Jill Nicolini once again.
Thank you guys. Have a good day. Brandon with questions.
Bye.